Good Monday morning, everyone. I wanted to talk to you briefly today about a case that's been in the news, and that's with Ruth Bader Ginsberg being hospitalized for complications due to a fall. It really speaks to the fact that none of us are immune from some of the maladies of getting older, the most important of which is injury, fall, and ending up in the hospital. So I think with that, we need to talk a little bit about fall prevention. A lot of my patients, when I ask them about exercise, are very forthright with saying that they're very good at walking. They will walk every day, and they really consider that their exercise of choice and what exercise that is really working for them. I often want to remind them, however, that there are more aspects to exercise than just walking, and this is especially true for fall prevention. When a patient falls, the best thing they can have is good stretching reflexes and good muscle responses. That means that you really need to be doing stretching exercises every day, 10 to 20 seconds per major muscle group, as well as muscle strengthening on a daily basis or at least 3 times a week. This is, again, your major muscle groups that you're going to be doing 10 to 15 reps with. I also think it's important to use appropriate assistive devices. This means if you need a walker, use it. If you need a wheelchair, use it. If you need a cane, use it. Really set your pride aside because you may end up in the hospital with a fracture if you don't use the devices that you need. It's also important to understand your bone density. The main complication of a fall really is a fracture. So if you don't have a low bone density and you fall, you're less likely to get a fracture. If you have a low bone density, even with a small fall, you could get a fracture. It's important to know your vitamin D level, as this is a key hormone in deciding on our muscle health and our bone health. There are medications to help with bone density. Some patients need them, some don't. There are risks to the medication, and the degree with which they help really varies. I think it's important to try to do things non-pharmacologically, like I've mentioned above. So I hope that helps with a little bit of a fall prevention, and I'm hoping that Ruth Bader Ginsberg gets better soon. So best of luck to her. And for all of my patients out there, get exercising.